audio sections. That makes it easier to listen to while driving and easier to memorize. I'll use the same format you've preferred before. Question, answer. Let's start with Section 1, SARS-CoV-2 and COVID-19. Section 1, Introduction, Etiology, Precautions, and Transmission. Question, what is SARS-CoV-2? Answer. SARS-CoV-2 stands for Severe Acute Respiratory Syndrome Coronavirus 2. It is the novel beta coronavirus that causes the disease COVID-19. Question, when and where was SARS-CoV-2 first identified? Answer, it was first identified in Wuhan, China in December 2019 before spreading worldwide and becoming a pandemic. Question, how similar is SARS-CoV-2 to the original SARS virus? Answer, SARS-CoV-2 shares approximately 79.6% of its genetic sequence with SARS-CoV, the virus responsible for the 2002 to 2003 SARS outbreak. Question, where do scientists believe SARS-CoV-2 originated? Answer, scientists believe it originated through zoonotic transmission, most likely from bats to humans through an intermediate animal host. Question, what gives coronaviruses their name? Answer, their crown-like spike proteins give them the appearance of a crown, or corona. Question, what is the purpose of the spike proteins? Answer, spike proteins attach to ACE2 receptors on human cells, allowing the virus to enter and infect the cells. Question, what are ACE2 receptors? Answer, ACE2 receptors are proteins found on many human cells, especially respiratory tract cells, that serve as the entry point for SARS-CoV-2. Question, what are standard precautions? Answer, standard precautions are infection control measures used for every patient, regardless of whether they are known to have an infection. Question, what are examples of standard precautions? Answer, hand hygiene, wearing gloves, masks, eye protection, and routine cleaning and disinfection of the treatment area. Question, what are transmission-based precautions? Answer, these are additional infection control measures used when patients have diseases spread by contact, droplets, or airborne transmission. Question, what are examples of transmission-based precautions? Answer, wearing N95 respirators, isolation gowns, screening patients, using HEPA filtration, and treating patients in negative pressure rooms when appropriate. Question, what precautions should dental professionals use for COVID-19 patients? Answer, dental professionals should use both standard precautions and transmission-based precautions, especially respiratory protection during aerosol-generating procedures. Question, what is airborne transmission? Answer, airborne transmission occurs when tiny particles smaller than 5 micrometers remain suspended in the air for long periods and can travel more than 1 meter. Question, what dental procedures generate aerosols? Answer, ultrasonic scaling, high-speed handpieces, air polishing, and the air-water syringe. Question, why are aerosol-generating procedures important? Answer, they increase the risk of spreading airborne diseases such as COVID-19 because they produce very small particles that stay suspended in the air. Question, what methods reduce airborne transmission in the dental office? Answer, high-volume evacuation, HEPA filtration, improved ventilation, and wearing N95 or FFP2 respirators. Question, what is droplet transmission? Answer, droplet transmission occurs through particles larger than 5 micrometers that travel short distances, usually less than 1 to 2 meters, before falling to the ground. Question, how do droplet infections spread? Answer, droplets land directly on another person's eyes, nose, or mouth. Question, how is droplet transmission prevented? Answer, surgical masks, face shields, and physical barriers. Question, how is airborne transmission different from droplet transmission? Answer, airborne particles are smaller than 5 micrometers, remain suspended in the air for hours, travel farther than 2 meters, and can infect someone even after the infected person has left the room. Question, what PPE is required for airborne precautions? Answer, N95 or FFP2 respirators along with proper room ventilation. Question, why is airborne transmission especially important in dentistry? Answer, dental procedures can convert large droplets into tiny aerosols, increasing the risk of airborne disease transmission. Question, what is one of the most important concepts to remember from this section? Answer: SARS-CoV-2 enters the body by binding to ACE2 receptors using its spike proteins. Because many dental procedures create aerosols, dental professionals must combine standard precautions with transmission-based precautions, including N95 respirators and proper ventilation. Quick memory check. Question: which receptor does SARS-CoV-2 bind to? Answer: ACE2 receptor. Question: what size particle is considered airborne? Answer: smaller than 5 micrometers. Question: what size particle is considered a droplet? Answer: larger than 5 micrometers. Question: name 4 aerosol-generating procedures. Answer: ultrasonic scaling, high-speed handpiece, air polishing, and the air-water syringe. Question: which mask is recommended during aerosol-generating procedures? Answer: an N95 or FFP2 respirator. When you're ready, I'll continue with Section 2, covering pathogenesis, symptoms, mortality, comorbidities, and current treatments. SARS-CoV-2 and COVID-19. Section 2, pathogenesis, signs and symptoms, mortality, comorbidities, and treatment. Based on slides 6 through 10. Question: what is pathogenesis? Answer: pathogenesis is the process of how a disease develops in the body, from the time the pathogen enters until it causes symptoms and damage. Question: how does SARS-CoV-2 enter the body? Answer: the virus enters through the nose, mouth, or eyes and binds to ACE2 receptors on respiratory epithelial cells using its spike proteins. Question: what happens after the virus enters the cell? Answer: the virus releases its RNA into the cell and hijacks the cell's machinery to make more copies of itself, eventually destroying the infected cell. Question: what is viral replication? Answer: viral replication is the process where the virus uses a host cell to produce new virus particles. Question: how does the immune system respond to COVID-19? Answer: the immune system releases cytokines and other immune cells to fight the infection. Question: what is a cytokine storm? Answer: a cytokine storm is an excessive immune response where large amounts of cytokines are released, causing severe inflammation and tissue damage. Question: what is a DARD? Answer: RDS stands for Acute Respiratory Distress Syndrome. It is a severe lung condition where inflammation damages the lungs, reducing oxygen exchange and making breathing difficult. Question: what serious complications can occur in severe COVID-19? Answer: ARDS, decreased oxygen exchange, and multi-organ failure. Question: what is the incubation period for COVID-19? Answer: the incubation period is approximately 2 to 14 days. Question: when does peak viral shedding occur? Answer: peak viral shedding occurs just before symptoms begin, making people contagious even before they feel sick. Question: what are the most common symptoms of COVID-19? Answer: fever, dry cough, fatigue, and loss of taste or smell. Question: what are other common symptoms? Answer: muscle aches, sore throat, diarrhea, and headache. Question: what are severe symptoms that require immediate medical attention? Answer: shortness of breath, chest pain or pressure, confusion, and bluish lips or face. Question: can people without symptoms spread COVID-19? Answer: yes. Both asymptomatic and pre-symptomatic individuals can transmit the virus. Question: why is asymptomatic transmission important in dentistry? Answer: because patients may appear healthy while still spreading the virus, making proper infection control essential for every patient. Question: what is the case fatality rate? Answer: the case fatality rate is the percentage of diagnosed patients who die from a disease. Question: what is the approximate CFR for COVID-19? Answer: approximately 0.8% to 3%, depending on age, region, healthcare access, and other factors. Question: which age group has the highest mortality rate? Answer: adults over 70 years old. Question: how have vaccination campaigns affected death rates? Answer: vaccination has significantly reduced severe illness, hospitalizations, and deaths. Question: what is a comorbidity? Answer: a comorbidity is an underlying medical condition that increases the risk of severe illness. Question: what percentage of hospitalized COVID-19 patients have at least one underlying condition? Answer: approximately 87%. Question: what percentage of ICU patients have one or more comorbidities? Answer: approximately 94%. Question: about what percentage of COVID-19 deaths are associated with 3 or more comorbidities? Answer: about 60%. Question: what medical conditions increase the risk of severe COVID-19? Answer: diabetes, hypertension, cardiovascular disease, obesity, chronic respiratory disease, chronic kidney disease, immunocompromised conditions, and active cancer. Question: how may periodontal disease affect COVID-19? Answer: periodontal disease may increase inflammation and potentially worsen the severity of COVID-19. Question: what is Paxlovid? Answer: Paxlovid is an oral antiviral medication that can reduce hospitalization by about 89% when started early. Question: what does remdesivir do? Answer: it shortens recovery time in hospitalized patients. Question: what is molnupiravir? Answer: an alternative oral antiviral medication with moderate effectiveness. Question: what is dexamethasone used for? Answer: it reduces mortality in patients who require supplemental oxygen. Question: what are IL-6 inhibitors used for? Answer: they help manage cytokine storms by reducing excessive inflammation. Question: what are some current areas of COVID-19 research? Answer: long COVID, universal coronavirus vaccines, nasal spray vaccines, and the connection between oral health and systemic health. Quick memory check. Question: what receptor does SARS-CoV-2 bind to? Answer: ACE2 receptors. Question: what is a cytokine storm? Answer: an excessive immune response that causes severe inflammation and tissue damage. Question: what does RD stand for? Answer: acute respiratory distress syndrome. Question: what is the incubation period? Answer: 2 to 14 days. Question: what medication reduces hospitalization by about 89% when given early? Answer: Paxlovid. Question: which patients are at the highest risk for severe COVID-19? Answer: older adults and people with multiple comorbidities such as diabetes, obesity, cardiovascular disease, chronic lung disease, kidney disease, immunocompromised conditions, and cancer. Question: what are the 4 most common symptoms you should memorize? Answer: fever, dry cough, fatigue, and loss of taste or smell. SARS-CoV-2 and COVID-19. Section 3. Variants, testing, wastewater surveillance, vaccines, and prevention. Based on slides 11 through 15. Question: why do viruses develop variants? Answer: viruses mutate over time as they replicate. Some mutations make the virus spread more easily, escape immunity, or cause changes in disease severity. Question: what was the Alpha variant? Answer: Alpha was first identified in the United Kingdom in September 2020. It was about 50% more transmissible than the original strain because of the N501Y mutation, which increased binding to ACE2 receptors. Question: what was the Delta variant? Answer: Delta emerged in India in October 2020. It was about 60% more transmissible than Alpha and caused higher viral loads and more severe disease. Question: what was the Omicron variant? Answer: Omicron was first identified in South Africa in November 2021. It spread very easily, escaped immunity more effectively, and produced multiple subvariants such as BA through BA. Question: what are the more recent COVID-19 variants? Answer: EG and JN became common from 2023 to 2025. They are more transmissible, cause milder symptoms, but have higher reinfection rates. Question: what do the CDC and WHO monitor regarding COVID-19? Answer: they monitor variants based on transmissibility, disease severity, and immune escape, classifying them as variants of interest or variants of concern. Question: what is the gold standard test for diagnosing COVID-19? Answer: RT-PCR is the gold standard because it detects viral RNA with the highest accuracy. Question: how accurate is RT-PCR? Answer: approximately 95% to 98%. Question: how long do RT-PCR results usually take? Answer: about 1 to 3 days. Question: what does a rapid antigen test detect? Answer: It detects proteins from the virus and provides results much faster than RT-PCR. Question: how accurate are rapid antigen tests? Answer: approximately 70% to 90%. Question: how quickly do rapid antigen tests provide results? Answer: about 15 to 30 minutes. Question: what do antibody tests detect? Answer: they detect antibodies produced after infection and indicate a past infection rather than an active infection. Question: why are antibody tests not useful for diagnosing an active COVID-19 infection? Answer: because antibodies develop after the immune system has already responded, not during the early stage of infection. Question: what is wastewater surveillance? Answer: wastewater surveillance is a public health method that detects SARS-CoV-2 RNA in sewage to monitor community infection levels. Question: why is wastewater surveillance useful? Answer: viral RNA appears in wastewater about 4 to 7 days before clinical cases increase, providing an early warning of outbreaks. Question: what laboratory method is used to analyze wastewater samples? Answer: RT-PCR testing after concentrating the sample and extracting viral RNA. Question: how does wastewater surveillance help public health? Answer: it helps identify outbreaks early, guides testing, supports resource allocation, and monitors entire communities regardless of who gets tested. Question: what are mRNA vaccines? Answer: mRNA vaccines such as Pfizer BioNTech and Moderna deliver messenger RNA that instructs cells to make harmless spike proteins, triggering an immune response. Question: what are protein subunit vaccines? Answer: protein subunit vaccines, such as Novavax, contain purified pieces of the virus with adjuvants to stimulate immunity without using viral genetic material. Question: what is the main benefit of COVID-19 vaccination? Answer: vaccination greatly reduces the risk of severe illness, hospitalization, and death. Question: why were dental professionals prioritized for COVID-19 vaccination? Answer: because they are frequently exposed to aerosols and respiratory droplets during patient care. Question: how long should hands be washed? Answer: at least 20 seconds with soap and water, or use hand sanitizer containing more than 60% alcohol. Question: what mask should be worn during aerosol-generating dental procedures? Answer: an N95 or KN95 respirator with proper fit testing and a good seal. Question: what ventilation is recommended in dental operatories? Answer: more than 6 air changes per hour, HEPA filtration, directional airflow, and allowing appropriate fallow time between patients. Question: why is surface disinfection important? Answer: it removes infectious microorganisms from high-touch surfaces and equipment, reducing disease transmission. Question: what type of disinfectant should be used? Answer: EPA-approved disinfectants used for the recommended contact time. Question: why is patient screening still important? Answer: screening helps identify patients with symptoms or recent exposure, reducing the risk of disease transmission in the dental office. Question: why should dental professionals stay updated with CDC and OSHA guidelines? Answer: because recommendations change as new evidence and new variants emerge. Quick memory check. Question: what is the gold standard COVID-19 test? Answer: RT-PCR. Question: which COVID-19 test gives results in about 15 to 30 minutes? Answer: rapid antigen test. Question: which vaccine types should you know? Answer: mRNA vaccines and protein subunit vaccines. Question: how long before clinical cases can wastewater surveillance detect viral RNA? Answer: about 4 to 7 days earlier. Question: what are the 4 major prevention strategies in the dental office? Answer: hand hygiene, respiratory protection, adequate ventilation, and surface disinfection. Question: what are the 3 COVID-19 tests you should memorize? Answer: RT-PCR, gold standard, detects viral RNA, 95% to 98% accuracy. Rapid antigen, fast results in 15 to 30 minutes, 70% to 90% accuracy. Antibody test, detects past infection, not active disease. High-yield exam review. Question. What are the most important facts from this lecture? Answer. 1. SARS-CoV-2 enters cells by binding to ACE2 receptors with its spike proteins. 2. Dental aerosols make airborne transmission a major concern during treatment. 3. RT-PCR is the gold standard for diagnosing COVID-19. 4. Vaccination significantly reduces severe illness, hospitalization, and death. 5. Standard precautions and transmission-based precautions are both essential in dentistry. 6. Hand hygiene, N95 respirators, ventilation, and surface disinfection are the key methods of preventing COVID-19 transmission in the dental office.